Everybody, it's Dr. Vinay, and today I'm going to help you prepare for your PRP session. So what do you need to do to prepare? Well, let's think about what we're doing. We're going to be drawing your blood, we're going to be processing it, and we're going to take that processed blood and we're going to inject it back in your scalp. So to help step number one, I want you to hydrate. Make sure that your veins are full so we can draw that blood out easily and get the best stuff to actually re-inject. For processing, you don't need to do anything. We're using Care PRP. I got this a couple months ago since making this video. It is the most amazing change in PRP technology out there. We're gonna get some really good PRP for injection. To help me with injections, I want you guys to not have too much hair product in your hair. Specifically, hair product makes your hair stick together. If you use oils or things that just make your hair softer, like leave-in conditioners, totally fine. I just don't want it sticky. Now, there are some special circumstances. If you're someone who is anxious, please let me know. If you used a benzodiazepine in the past, like Xanax or Valium, we should probably do it for the procedure, and I will prescribe it for you. If you're afraid of blood draws, or you've passed out before, I want to make sure you ate before your procedure. And that when you come here, we give you juice, you're pumped full of nice blood sugar, and if you pass out, it's not going to be as significant. If you have a history of headaches, let's take Tylenol beforehand. About 1 hour before your procedure, take 1,000 milligrams, and that should help control headaches after the procedure. A lot of people ask me whether PRP is going to hurt. And I tell them, if you're a guy, absolutely. If you're a girl, it's not going to hurt. So I'm just kidding. Most people walk out of my office saying that this was nowhere near as bad as they thought it was going to be. In fact, I don't remember a single person who said it's as bad as they read. So it is not a great comfortable procedure, but expect to walk out of here surprised that it wasn't so bad. The next question I get is whether you can go to work right after your procedure. And the answer to that is yes, depending on your hairstyle. If you're a guy, we have a barbershop downstairs. I can easily wash out everything in your hair and just restyle it and you can be on to work, no problem. If you're a female, I'm a little afraid to wash your hair, but I will clean up as best as possible and you can go home and take a shower right afterwards. You don't need to wait. I will give you a baseball cap so you can get home, no one knows. So the answer is, yeah, you can go home. Let's just make sure your hair is clean. Next question, can you shower after your procedure? Absolutely. There's no reason you can't shower. We've injected the PRP. Your shower is not going to push it out. But there's one thing, I don't want you taking too hot of a shower. Because too hot of a shower could actually increase the blood flow to your scalp and it can dilute the platelets we put in. So yes, take a shower, just make sure it's not so hot. Next question, can you exercise after PRP? This one is a no. We don't want to increase the blood flow to your scalp and we don't want to raise your blood pressure. Both these things can dilute out the growth factors from the PRP. So take the day off and tomorrow you can go fully at it. So let's talk about the procedure. What are the important steps we're going to go through? Well, important step number one is actually drawing your blood. And interesting enough, this is the hardest part for me because it's embarrassing if your doctor can't draw your blood and do your procedure. So I need you to hydrate. If you have a history of being a difficult stick or having hard to draw blood, just let me know. I have a great medical staff that can come to your procedure if we let them know ahead of time. So step number two, we're going to put that blood into a specialized separation chamber. Now, this is one of the most amazing technologies that exists for PRP today. About 4 to 6 months before making this video, it revolutionized how I do PRP, and I know the results are just getting better and better. Once it's in that chamber, it goes into centrifuge for a couple minutes. Step number three, while that blood is processing, we're going to start numbing up your scalp. Now, this is not the part that you hear horror stories about online. That's actually injection of PRP. But in our office, this is the part that could be a little uncomfortable, but really isn't that bad. That's because we have adopted techniques to make this as comfortable as possible for you. When we inject, we go from one side with one injection to the other side for injection number two, and then back to the other side. What does this do? It allows the anesthesia to take action before we come back for the next needle stick. And you get through this in about 5 minutes. Feel great. Now, if you have a little bit of additional anxiety, we have nitric oxide. That's laughing gas. In 30 seconds, it's going to make you dissociate, put you in a la la land, let me get through injections, and a minute after I'm done, you're going to feel totally normal, no residual effects, you can still drive home. All right, step number 4 is probably the coolest from a scientific standpoint. We're actually going to finish processing your PRP. So when your PRP comes out of the centrifuge, it's going to be separated into liquid plasma and to solid cells. Now, this is the first technology I know that can do this really, really well, because those cells are then further separated into platelets, white blood cells, and red blood cells, which we can separate. We can take those platelets that are pure and concentrated and put them in the plasma, which is really ideal for injection. But what this allows us to do is not just have plasma that's actually pouring platelets, or take other cells like red blood cells that can cause inflammation and some shedding from PRP. We get pure, high concentrate plasma with real platelets. So I would say there's actually two critical parts to a great performed PRP. And this is step number one, getting the perfect PRP to inject into your scalp. Now that we have the PRP we want, we're ready for step number 5, which is injection of the PRP into your scalp. Now, I consider this important step number 2, and it's all based upon technique. If you go online and you read about this step, this is the one that people say is excruciatingly painful, that they get about 20 injections and they'll just never come back for their second session of PRP. But remember, we took the time to do your numbing, and all that pain is over. I can do 200 to 300 injections in your scalp that you're not going to feel. I can also place them directly at the level of the follicle where they can be most effective. We're not just going to do 20 injection lumps. We're going to go. We're going to get this exactly where you want to restore your hair. And while we're doing this, one of the most amazing things that's going to happen. Those platelets are going to activate. We're going to see them in front of our eyes. So in the medical community who does a lot of PRP, the question is, do these platelets activate and release their growth factors? Well, in my syringe, as we're injecting, we're going to see a little clot form. That clot are the platelets fusing together, and we know that they have just released their growth factors into the surrounding plasma, which we're injecting. During the procedure, I will show you that clot. It's the same clot that forms in a heart attack, so it's kind of dorky, sciencey moment that we get together, but it's really, really cool knowing that these platelets have been activated and we're actually getting the treatment we want. All right, it sounds like we're all done with your PRP session. Not exactly. I really want this PRP session to fit into your life. We're actually going to do a step for cleaning. For guys, we have a barbershop downstairs. I'll actually wash out your hair, you can style it, and you can actually go directly to work. For women, it's a little bit harder for me to wash your hair, but I will try, and then we'll detangle it such that it flows nicely. I'll give you a baseball cap so you can get home and you can take a shower right away. And that's the last step of our PRP, making sure you can go back to your day without feeling like you did anything. So you're done with your PRP session now. What should you expect afterwards? Well, remember, during your session, we put local anesthesia in your scalp and you were numb. Eventually this is going to wear off and you're going to start feeling the PRP that we did. It might feel a bit tender. You might feel some throbbing because blood flows increase. These are all indications that we create an injury zone, which is exactly what platelets normally do in your body to respond to injury and start the wound healing process. Sometimes this throbbing can last a day, and I've seen it last up to 10 days. If it lasts a very long time, I've actually never seen it be a negative effect. In all those patients, I've seen a positive response to PRP. It's probably due to increased blood flow and the fact that we actually did 200 to 300 injections, so you just didn't feel at the time. Another thing is swelling. A lot of people ask, hey, you injected all this local anesthesia, you injected all this platelets, it looked like half a Coke can's worth, what happens? Well, it is true. We have a lot of volume we put into your scalp, and about 20% of people, you're going to see a little bit of swelling right across the front here. It usually dissipates in about 2 days. However, 20% of those people, or like 4% overall, that swelling tends to move down into the face, and when it hits the eyes, the skin is so thin that they can poof up and it just doesn't look like you want it to. And that is a very unfortunate thing. It's very hard to prevent or know who's going to get it. In fact, I did PRP on my aunt and she had that swelling. And of course, I would have done her procedure the best I could. If you start getting swelling, what I want you to do is start massaging this little welt outwards and down to the front of your ear. We want to go into your lymphatic system, and what we're doing is just using a little manual massage to push it that way so it can clear faster. And hopefully we get it out to the sides and prevent it from going down towards our eyes. So that's how we do PRP at Northwestern Hair. And if your session's coming up soon, remember those couple things. Hydrate, hydrate, hydrate. If you're going to put products in your hair, just make sure they're not sticky. If you had a previous history of anxiety, let me know so we can help take care of that beforehand. If if you passed out before or from your blood, please make sure you eat some food. And if you have a history of headaches, take some Tylenol. I'll see you pretty soon.